Hi guys, how's everyone doing? I am Benecia Williams.
And I'm Sheena Booba, and together we are Sheenecia.
Yes.
So that was a term that was given to us when we did residency together. You know, we're always on the same wavelength. We could read each other's minds and complemented each other very well with our individual strengths. So that's our nickname, and we're sticking to it. So
yes,
we are
Sheenecia.
So we're physical medicine and rehabilitation physicians, also known as PM&R physicians, also known as physiatrists. So we're so special. Our field is that we get two names, so physiatry and physical medicine and rehab. So some people may be confused, you know, what's the difference? So it's actually the same field. And just to give you guys some numbers, so we're really, really small. So we're about 8,000 board certified physiatrists in the US out of 950,000 active board certified physicians. So if you do the math there, you can see that we're a small field. It's getting very popular, and therefore can get competitive, and it's been getting competitive over the years. So if you go to the NRMP website, and I'll post this link on our Instagram account tomorrow morning, I'll give you some more specific statistics, but the 2020 match was just the other month or so, and so some of the statistics that I found interesting were, so there's 39 categorical programs. So categorical meaning the residency program has PGY1 through PGY4 in it. And so there are 39 programs and 151 spots, and all 151 spots were filled during this last match.
That's excellent.
There's 66 advanced programs. So those are the programs from PGY 2, 3, and 4. So those are the ones after you do a transitional year or prelim year, and we'll go into much more detail about that in one of our other talks. But out of those, there were 316 spots, and only 4 went unfilled. And usually, you know, for some reason this year there's a little bit more unfilled spots. I don't know what the story was behind that, but usually there's only like 0 or 1, you know, spots. So out of the 467 total PM&R spots, 4 went unfilled. I'm sure those filled in the SOAP. So 463 doctors, you know, were matched. And out of that, 252 were MDs and 182 were DOs. So you can see that PM&R is actually a very DO friendly field. 20 were US IMGs. Yep, Dr. Benecia Williams is a DO, so shout out. So 20 US IMGs, meaning like US citizens who went to maybe a school in the Caribbean or maybe somewhere in Europe. And then 9 non-US IMGs, so maybe from other countries. I think the most popular PM&R is Mexico, Nepal, and India. So those are just some stats. Like I said, I'll post a specific post on that tomorrow, just so you guys can have those numbers in front of you. Going a little bit more into the field of PM&R, so we're probably the most diverse in terms of like what you can do within the field. So you can really make it your own niche. So we're the medical specialty that diagnoses and manages neurological and musculoskeletal conditions. So specifically patients with spinal cord injury, traumatic brain injury, stroke, amputations, pediatric population, you know, kind of the most common diagnosis you see there is like maybe cerebral palsy. And then you can also treat neck pain, back pain, hip, you know, knee pain. So wide variety of patient population there. And with that, not only are you treating patients, you know, with these issues, you're also working in a team. So oftentimes you're working very closely with physical therapists, occupational therapists, speech therapy, neuropsychology. So you have really got to be a team player if you want to go into this field. What else can I tell you about it? So we also perform a lot of electrodiagnostic studies, so nerve conduction, EMGs. We prescribe medications for maybe agitation after brain injury or spasticity, which is, you know, people who have strokes or people who have had a spinal cord injury. Sometimes they can get these contracture-like positions, and you can help use Botox and other things like phenol to help kind of relax those muscles so they can use their extremities a little bit better. And then, you know, obviously spine and joint injections. So a lot of variety. and just in general, that was a little bit about our field. So I'll have Benecia kind of talk about exactly what we are about and what we're trying to do with this platform.
Yeah, so Sheena and I, like she said, we went to residency together, and I had an opportunity to be a mentor on someone else's Instagram page a couple weeks ago. So I decided to do an Instagram live where I invited Sheena on, and we had a really good response. We had several people just asking us questions about our field. So I hit Sheena up. I was like, we should do this for, more directed towards PM&R, because we know with the pandemic, medical students are losing their away rotations. We've had several come into our office and saying, their interviews are going to be virtual now, or they just can't even go to the program. So we saw that there was a gap in the education system for medical students as well as residents. And we just kind of wanted to fill that gap and offer our experience in the field of physiatry. We get emailed all the time by students all across the country and ask for our advice. So we said, well, we might as well make it available to everyone. We have this platform, and we're both, we try to say that we're pretty technologically savvy, but we have been on YouTube a lot to learn these things over the last couple of days. So yeah, we're just excited to be with you guys. So some of the things that we have planned for you, we just started a new Instagram page. It's at the.virtual.physiatry.mentors. Follow us on there. We're going to have daily posts about physiatry and what it represents. So on Mondays, we will do things that are facts about the field, fun little facts that will be on there. On Tuesdays, there'll be PM&R pearls. These are things you should definitely know when you're on a rotation for physiatry. And Wednesday, we'll do nerve conduction / EMG, love it or hate it. Sheena's definitely more on the love it side. I'm on the hate it side. Those are going to be coming from Sheena. On Thursdays, we'll highlight musculoskeletal and spinal injuries. That's both things that Sheena and I really hold dear and enjoy. And then on Fridays, we're going to be doing, did you guys probably saw my dad peek through? On Fridays, we're going to do the business of medicine. And Sheena already posted an Instagram Instagram TV post about how her day is kind of set up. And this Friday, I'll do mine for you guys. We also plan on having guests, hopefully every week on Sundays. Our first guest that we have up is he has mentored both of us, and I actually have the pleasure of calling him my partner because we work with each other every day, is Dr. Omar Salad. He's mentored well over 150, 200 medical students into the field of PM&R. So he has a lot to say about what medical students should be doing right now to get ready for their rotations. So we'll have him on. The following Sunday, we'll have Dr. Nicolette Finger. She just graduated from medical school from Texas College of Osteopathic Medicine. So congratulations to her. She's going to be starting her internship in PM&R residency in San Antonio. So you can follow her at nicolette.life on Instagram because she documents her whole journey. And we look forward to having her on and hearing her story. And then the following Sunday, we will have Dr. Yi Chu. He's currently an intern at Medical City in Weatherford, and he will be going to Baylor University Medical Center, where Sheena and I both did our residency, starting as a PGY2 here in July. So we'll hear about his experience as an intern and offer our advice as what he can expect as a PGY2. So a little bit about me. I am born and raised in the Bay Area, California. I'm actually named after the city, Benicia, which is right between Sacramento and San Francisco. I went to Cal State Sacramento for undergrad, where I majored in kinesiology. I thought I was going to go into physical therapy school, and decided my senior year in college that I wanted to go to medical school. So I took a few years off, did my prerequisites. I did a post-bac program at Texas College of Osteopathic Medicine. And then if you got over a certain GPA, you had automatic acceptance. So I just transitioned nicely into going to medical school there. That is when I met Dr. Omar Salad as a first-year medical student. And he came in and talked about how fun PM&R. I was like, oh my God, I want to be just like him when I grow up. So I followed him throughout my medical training. I think I rotated with him a total of like 6 months from medical school intern year, and then as a resident at Baylor, and then he offered me a job. So I am now one of his partners. There's 5 of us total at PM&R Fort Worth. What about you, Sheena? Have you had any mentors that have touched your life?
Yeah, for sure. I'll tell you a little bit about my story too.
Yeah.
So I was born in Plano, Texas, and then I went to undergrad at Austin College up in Sherman, Texas. So it's a very small liberal arts school known for their pre-med program. So if anyone's looking for a good undergrad that's small, I highly recommend it. It's actually smaller than my high school. So like my
I didn't
high
know
school,
that.
was yeah, like 900 or so people graduated from Plano West, and my Austin College was like 350 or so. So it was like,
Oh,
usually it's the
like a
opposite
little,
when people go to college.
yeah.
And I majored in sociology. So just, people are always saying, oh, you have to, major in biochemistry or biology to get into medical school, but really you just have to do the prerequisites and just, still do, if that's what you enjoy, obviously, major in that, but I also had a passion for sociology. So that's why I majored.
I would say definitely major in something that you enjoy.
Right.
Yeah,
exactly.
right.
Yep. And you think that you can do well in, right? Because you have a good GPA to get into medical school. So,
I minored in dance, so a little known fact.
So I had to take the MCAT a few times. I didn't get in the first time when I applied. And so during that 1 year when I was reapplying again, I actually did the AmeriCorps. I don't know if you guys have heard of that, but it's like the Peace Corps, the domestic version. So I worked in a nonprofit in New York City called Medicare Rights Center. So we did a lot of like healthcare advocacy. And so I think that was I was very fortunate to have that year to kind of learn about insurance, because you may not learn a lot about that in medical school, unfortunately. So then I got into Texas A&M in College Station. That's where I went to medical school. And I did my residency with Benecia at Baylor in Dallas. So we kind of stayed around Texas. So since Baylor Dallas is a advanced PM&R program, so you start after your PGY, 1 year. So I matched into a PGY 1 year in prelim internal medicine in Brooklyn. So I did that for a year and then came back to.
I came and visited her.
Yes.
In Brooklyn. It's fine.
And then I did my fellowship in interventional spine and musculoskeletal medicine in Phoenix at Desert Spine and Sports Physicians. So that was a non-ACGME fellowship, and we'll do a whole talk on, ACGME versus non-ACGME. I know you guys have a lot of questions about that and why we chose the way we did. But yeah, in terms of mentors, we already brought up one, Dr. Omar Salad. He is great. We rotated with him as a resident. He taught me a lot about private practice, and you'll see, like in residency, not everyone is perfect, right? I think we take, what we like from different attendings. And so, there's one attending where I learned a lot about how to read an MRI. We spent a lot of time kind of going over images. And so when I started my fellowship, I felt very, very prepared, looking at an MRI of the spine and kind of going through that. And then you made a post on that just on Thursday, I think, just looking at a normal MRI. And then a few other physicians during our residency. One was, he started around the year that we did. So he was a new attending, Dr. Mukherjee, and he loves EMGs. So I really got to learn about just how to, interact with the patient when you're performing EMGs, and just being really, compassionate and just, making sure that they're doing okay. And then also just his work ethic on ultrasound. He would stay after his work and just kind of practice on himself. And so Benecia and I actually kind of, we were able to get an ultrasound machine for our own residency, and we would stay after hours and really made our own rotation, kind of just teaching each other how to use.
Really? We spent hours during residency, head to toe scanning each other. With the ultrasound.
What
I didn't even talk about, I guess I guess I didn't even talk about we obviously went to residency together. I did my intern year at John Peter Smith Hospital in Fort Worth, which is a transitional year, which is a super fun. I call it being like a fifth year medical student, because you kind of rotate through everything, but it's a great program. And then I actually did my sports medicine fellowship back at JPS. So I started my career and ended my training career at JPS before joining on to PM&R Fort Worth. Some more mentors, Dr. Landley, who works with Omar Salachi, has been a great mentor to me as well. Just learning the business of medicine. It is very much a business in private practice, and I don't think you get a lot of that in residency. We had a lot of talks, but actually like talking about it and doing it are two totally different things. So you're on a very quick learning curve, I would say, like your first 6 months as an attending on the business of medicine. And we can do a whole separate talk about that. And even just like contract negotiations and going over things like that. What else about
you
me?
guys have any? Oh, my mom's on. Hey, Mom. Happy
Hi,
Mother's Day.
Happy Mother's Day.
You guys have any questions just about us and what are you guys looking forward to?
Yeah, I see Dr. Yin Lee's on there. She works at UNT Health Science Center. She's PM&R. So we'll have to have her. She'll be a great guest. We'll have to have her on.
Yeah, we're really excited about these Sunday talks because we have like within like each, we'll have someone talking about spinal cord injury, why they went to it, kind of what their process was. I think we have someone for brain injury. Benecia and I, Benecia did sports medicine. I did more interventional spine. People who are doing inpatient or consults. Yeah, so we have a lot of interesting and fun guests. So
yeah, there's so much in the field. That's one of the big things that Omar had taught me. He's like, try to do as much variety as you possibly can, so you can always stay busy. You can kind of titrate up things and titrate down things. So yeah, we do a lot. And I guess I can talk about like my private practice, how my day-to-day is. Yeah. And then and I'll highlight again this on Friday. So I do a lot. So there's 5 of us in our group. 4 of us take call in our inpatient rehab unit. And during that week, I just do admissions into the inpatient rehab unit. And then on the weekend, I round on those patients. And every 3 times a week, I do acute consults. So those are patients typically who just had a stroke. I'm one of the first physicians that they meet. And my job there is to just make sure they get the appropriate aspect of rehab, whether it be inpatient rehab, skilled nursing facility, home health, or outpatient. And then I do outpatient clinic every day. And in my clinic, it's a variety of things I'm seeing, anywhere from stroke care, spasticity care, migraine, Botox, spasticity Botox, as well as just the bread and butter, back pain, neck pain, knee pain, shoulder pain. And then I do ultrasound injections in clinic. And then usually 3 to 4 times a month, I have an injection day where I'm doing fluoroscopic injections of peripheral joints and then the lumbar spine. So yeah, and then I used to go to a skilled nursing facility. I don't do that anymore. And then every other week I go to a long-term acute care hospital. So
you'll never get bored. You have such a wide variety in what you do in your practice, though.
So much, yeah. But I'm sure as I practice longer, it'll kind of get narrowed. I'm just, when you're new attending and trying to build a private practice, like I'm in a place of yes. So I'm like, yes, I will do everything. But it's fun. Like I said, my day is not monotonous by any means. Every day is different. I'm like, what am I doing today? What's it like? Kelly asked, why did we choose the specialty we're in?
Good question. Yeah, so I always knew I wanted to be a doctor. My parents are not doctors, but I had some doctors in my family, so I was kind of exposed to the field. And I grew up playing sports, so I had this like innate fascination with the muscles and bones, and I'd get injured every now and then. And I had an injury in high school when I was playing basketball where I like dislocated my pinky and went like all the way like this, little like that. And so I took the x-rays to school. You guys may have heard this story where I hung them on my locker just so I could show them to everyone. I was so proud of those x-rays. And so I'm not sure how many people are obsessed with their own x-rays, but yeah, so that kind of pushed me into the field. And the x-ray. So
yeah, right after the x-rays. And then I was like, oh, and I'm looking at both screens. You guys have to see my setup because we're zooming from our computer, but I have my Facebook Live on my phone. So like I'm looking back and forth and I'm like, am I moving? I'm like, oh, I'm still moving. So Sheena's not moving.
You were close enough.
But yeah. Hi guys. So I'll tell you why I chose a specialty, why Sheena unfreezes. So like I said, I was a kinesiology major in undergrad, and I was also a dancer. I danced for about 20 years. And I had thought I was going to go to physical therapy school, and I did a sports medicine rotation at UC Davis my senior year, and I just really enjoyed that internship of working with the sports medicine doctor, working with the athletes. And I had decided then, this was literally like a semester before I graduated, that I was going to go to medical school. So I was like, I'm just going to finish out my kinesiology degree and then go back as a graduate and I had to take like organic chemistry still and a couple other classes. So I went ahead and did that. And then I went ahead and applied to a post-bac program, which I'm so glad I did. In the meantime, I was also moving to Texas. So I did my post-bac program here. I got residency, which helped save a lot of money for medical school. And then I met Omar Salat, and he was like, hey, if you like anatomy, if you like neurology, you're fun, you would probably like PM&R, come check it out. And I was like, oh, check, that's me. I was like, oh yeah, that's me too. So and then I rotated with him. That was my very first rotation as a third year medical student, and nothing else compared. So I knew that was the field for me. Back to this
Awesome.
pinky.
Oh, yeah, thank you. Thanks, John Burgess. He's paying attention, so that's good. So, okay, yeah, my pinky, I took it to school, the x-ray, and yeah, anyway, so I knew I really wanted to do medicine, and I got my first year of medical school, even like the first week. So I went on the AAMC website where, how they list like all the medical specialties, you can kind of read about them. And I got to physical medicine and rehab. And so I thought I wanted to do orthopedic surgery because it was, a perfect fit. I thought, you got to work with sports medicine and muscles and bones. And I like to work with my hands a lot. So, but for some reason, I just didn't want to be like doing actual surgery, like in the OR with that kind of lifestyle. And so I got to PM&R and I read the description and I was like, oh my gosh, this is kind of exactly what I want to do. And I got really lucky because I was in College Station for medical school, and that year in Austin was the AAPM&R conference. So it was the first year they were actually, going to have medical students. And so there was like only like 10 of us there. Nowadays it's like there's a whole day, just for medical students and stuff. But it was about 10 of us, and we got to just, ask a bunch of questions about the field. And so I heard about the RIC Rehab Institute of Chicago. I guess now it's called the Shirley Lab. They do an externship every year for medical students between their first and second year. And so I applied and I got in, and that exposed me to like everything about the field. I think it was almost 2 months. So I got to work with people with spinal cord injury. And so that's when I really got hooked on it. So I knew it like my first week of medical school that this is what I wanted to do. So I had a lot of time to kind of prepare and get experience,
Right.
Because unfortunately, a lot of people don't hear about it until their third year or even fourth year of medical school. Yeah,
I hear it all the time. We at our hospital get internal medicine residents that come and rotate with us, and they're like, "This is so fun." I'm like, "I know, you're already invested too late." But if you can find out about it, like your first or second year of medical school, you're golden. But even if you find about it your third or fourth year, that's not the end of the world. Like there is still time to get you to where you want to be. We have my other partners on there, Neha Shaw. We'll have to have her on. She does a lot of inpatient rehab. That's your invitation. Thank you. What's up? We're excited to have Omar on next week. You guys will, if you haven't met him, get ready. He is quite a character, but he has so much good information for you guys.
I'll tell you a little bit about my practice, since Benecia, you got to
please do. Yeah.
So I do only outpatient. So I work in a multidisciplinary clinic. So we have ortho and neurosurgery, spine physicians, and then there's 3 PM&R doctors. So there's a lot of surgeons in our practice, so which is nice. So
it's great.
We've been in practice for about almost a year and a half, maybe a little bit over a year and a half. And so I've gotten really busy in the fact that I get a lot of internal referrals. So that's been, very nice. So my days consist of just seeing patients with neck, back pain, musculoskeletal issues, I do nerve conduction, EMG studies, and then I do a lot of fluoroscopy guided injections, cervical through lumbar. And then I do a little bit of ultrasound as well. So yeah, so strictly outpatient, but I love it. It's great.
Fun. It's a great field. It really is a lot of fun. So I guess we're almost at our probably a 30-minute mark-ish. Yeah, almost. Look at us to RT, despite the technical difficulties.
Yeah,
any other questions out there?
2 minutes.
Yeah. If not, we will post this on our IGTV page at the.virtual.physiatry.mentors. So you can tell your friends about it, and yeah, next week's gonna be great.
And we gotta do our thing now where we end. Remember, we're gonna discuss.
Oh yes, okay, Sheena. If you were not a PM&R physician, yes, what would you be?
So you guys may not know this about me, but Benecia does. I love making spreadsheets and I love to plan.
She has an Excel sheet for everything. I'm like my friend, she has it covered. Don't worry about it.
I love to travel. So what I would probably do, I don't mind making spreadsheets for a living. So I would love to be a travel agent and plan people's trips day by day, their itineraries, find restaurants, where to go, that would be ideal.
She has done this for me, you guys. It's been great. It'd be amazing.
When I retire at age 45 or so, that's my goal, right?
Yes, when we retire.
I'll be a travel agent.
Yes, you will.
What about you, Benecia? What would you be if you weren't a PM&R physician?
I would be a trophy wife. I'm just kidding. I always tell people I'd be a trophy wife. No, if I was in PM&R, I would probably be something like a makeup artist. My best friend, shout out to Katina, is a makeup artist. She's been a makeup artist for 20 years.
That's great.
And I just enjoy, I put makeup on for the first time in a long time because of COVID messed everything up. I wear a mask at work every day, so can't wear makeup because it breaks me out. But anyway, side note, yeah, I'd probably do makeup artist or something like in the beauty industry.
Nice.
But I'm glad I found the field I of PM&R. It's great.
Yep.
Awesome. Someone said no job security. There is no job security in either one of my jobs. Choice is trophy wife or makeup artist. Yeah, so I guess we'll call it a day, guys. Hey, follow us on our Instagram at the.physiatry.mentors. That's it. That's all. Did I miss? I was about to say .com. Just kidding.
Virtual. You know the word virtual.
That word.
Some combination.
It's Virtual Physiatry Mentors. Just type it in, you'll find us. As well as on our Facebook page.
There you go. All right, you guys have a great week.
Yeah, bye, Anne-Marie. Thanks for watching, guys. We'll talk to you later. All right, bye-bye.
Bye.